The most common misconception patients have regarding implants is that they are quick. So a lot of times patients hear teeth in a day and on the radio, or it could be a commercial, and that applies only to full arch implants. So where they take out all your teeth and they place four, could be six, several implants in within that day, or sometimes the next day they give you teeth to replace that. However, most single tooth implants could take up to a year if it includes the extraction time, depending on how big the state of the bone, or it could also be the patient's medical condition. Another misconception patients have regarding dental implants is that it's something painful, or they also like sometimes they imagine like a nail from Home Depot as something going into their body, and if that is the image, that's very scary. However, the actual procedure, if the bone is good, should be painless. You could tell something is happening, but it should be relatively easier than many extractions. It should be sometimes it's a very quick appointment. So that's something I would like patients to know. Another misconception is implants last forever. That is not the case. So just as you can lose a tooth due to bone loss if you're not cleaning properly, if you are biting too hard on a tooth, you can cause some problems. The same thing can happen to an implant. So if you're not cleaning properly, you just get it taken care of. You don't go to the dentist after a couple of years, or you only address the front and you don't address the back teeth as well. That can cause too much stress on the implant, or a dirty implant can also lose bone and it can come out. Sometimes it's very painful, sometimes it's painless, and it can just come out. The patient can take it out by himself. So an implant is not forever if not properly maintained. So a lot of times the aha moment for the implant process is all the way at the end. I said it's a long process, and a lot of times while they're going through it, the patient kind of feels like, "What am I doing? Like spent money and I'm just waiting." But I just want to clarify that that doesn't mean that nothing is happening the whole time. So a lot of times the healing for a bone takes several months. So that being said, they kind of realize at the end they're pretty happy that they went through with that process, but it does take a while to get to that point of realizing, oh, this is the right choice. My experience recently has been a lot of patients want to take care of just the front and they don't necessarily want to take care of the back. And the situation I've seen down the road is sometimes the cosmetic work that the patient's very happy with in the front. Sometimes things start to chip, they start to break, some teeth get loose, and they don't take care of the back. And that is very important that they do not skip that. Like the simplest illustration is you're missing four tires and you just put the front two on. So what's going to happen to those front two is they're not going to last as long as if you had four tires. It's very important that patients understand that the back teeth creating a really stable bite, which a lot of times do require implants if patients are missing back teeth, is super important and really affects the long-term outcome of any cosmetic work they want to do. A lot of times patients they don't see the long-term results of leaving a spot without a tooth. So if you're missing one tooth, it's not like your jaw muscles get any weaker. It's not like you eat only soft foods. Most likely you're not going to change that. So what's going to happen is the remaining teeth are going to have problems faster and faster. And it's very important to address it almost as soon as you can. Sometimes patient finances are a problem, but it's very important to address it right away and ensure the longevity of the rest of your teeth. The easiest thing I would tell people is that it's most likely going to be easier recovery than the extraction. You know, a lot of people are worried about implants, and that is a scary thing to them. But if the patient's really numb, they really shouldn't feel too much. And the recovery, there may be some soreness, but it shouldn't be worse than the extraction, which I don't know if that makes people feel better, but it shouldn't be worse than that. That's what I like to tell all the patients when they get it done. I'm like, "What is it gonna hurt?" I'm like, "Well, it's not as much as it's gonna be better than the extraction." For patients who want to protect their implants, the most important thing they can do is be realistic with their home care and realistic about how clean they actually are. So if they're not doing a good job at home, even the best surgery, the best crown, it's not really going to matter that much in the face of a really dirty mouth. So just having frank conversations like, hey, the reason you lost this tooth is it was your mouth wasn't the cleanest. So if you want to take care of this investment, you need to take care of it at home. And along with that is getting regular care at the dentist. That is probably, I wouldn't say it's as important as taking care of everything at home because you could be really good about coming in but do a terrible job at home. But the most important thing is after good home care is coming to a dentist regularly just to make sure nothing serious is happening before it's too late. So for natural teeth, nothing beats floss. But for an implant, it may be better to do water pick. More recently, research is coming out that sometimes flossing can disrupt the connection of the gums to the implant crown. So water pick is a little more gentle and can clean more thoroughly without causing any problems. Water flossing a lot of times is easier for patients, and that's why they like it. And a lot of times they'll end up using floss pick, which is very good. However, around dental crowns, a floss pick can be a little cause some problems. So when you floss down, and then you pull back up, sometimes it can cause too much stress on the cement and it can cause the crown to come loose and require re-cementation. However, when you use regular floss, you can floss down and then pull out the side. It will allow you to floss, but also decrease the amount of stress on the cement, which is a good thing. And then another reason that people don't like flossing is it's very hard for them. But the main reason is I spent a lot of money on my dental school loan to learn this, but everyone wraps around their index finger. Now, when you move it, you don't really have any control. It's like hard to get in the back. The better thing to do is wrap around your middle finger. So if when you want to do the top teeth, you all of a sudden have a lot of control getting in the back. And then when you want to do the bottom teeth, you can use your index finger and then you have a lot more control. So when you use the middle finger, it's way better. It's a lot less frustrating. What is the most important to the patient? So if time is the most important to the patient, a lot of times implant is not the best option. Examples are patient is getting married or there's an event. There's many situations where time is the most important. Implants are not fast. It could take up to a year until you actually get something in that place of the tooth. So, and bridges are much quicker. So bridges could take 3 weeks, depending on the case, but it just depends on how quick the lab can make the bridge. But that's very fast. So if the patient's young and there's two healthy teeth next to a missing tooth, it doesn't feel very good to remove a lot of healthy tooth structure. However, if the patient's older and those teeth need work anyways, a lot of times it's two birds with one stone, and it's good to take care of those all at once.